A very good evening. You're watching the India Development Debate. I'm Tamanna Inamdar. Now, as cases of those infected in India go above 400, the biggest question everyone has is how far are we from community transmission and can we avert reaching that stage? As per the ICMR, we are not yet there. There are stray incidents being reported of people testing positive for COVID-19 with no known travel history or clear contact with someone who has tested positive. But this is still being investigated. Meanwhile, the rate at which cases are being reported has jumped tremendously in India in the last 48 hours. The pace has increased. This despite lockdown and social distancing in place. In fact, governments going the extra mile to ensure that it doesn't spread. In the state of Maharashtra now, there will be a curfew in place. Travel between districts is also not being allowed, considering that the highest number of cases so far are coming from the state of Maharashtra. So the question is, how can we stay safe at this time? Can India avoid reaching the community transmission phase? To speak on all this and more, I'm joined now by Dr. Arvind Kumar, Chairman and Lung Surgeon at Gangaram Hospital, and Sujatha Rao, former Health Secretary of Government of India. Welcome to both of you and thank you for speaking with us. Dr. Arvind Kumar, I'm just going to come out and say it because this is everyone's concern right now. Can community transmission be avoided? Essentially, that means that even if you have had no travel history or contact with someone who already has tested positive, you are still at risk, that there are people unknown to themselves also possibly carrying this around. Now, that's a bad case scenario. It's a worst case scenario. How far do you think we are from it?
Tamanna ji, thank you for that question. What I would like to say as a doctor who's been watching the development, who also watched the China-Italy developments very carefully and has also been watching the developments in the country, I think the steps which have been taken by the central as well as the state governments, they are timely, they are very, very effective, provided they are followed in their entirety by the people and the purpose for which these steps have been taken is achieved. Now, what is the purpose of this lockdown? The lockdown is not to keep you away from office and then allow you to go to markets or have big congregations. The very purpose of lockdown is to prevent physical transmission of the disease by means of droplets, direct droplets, person to person, or via dropping those on the surface and then hand-based transmission. If all the people in the country, except the emergency services one, they were to lock themselves up in their houses and have no contact with each other, the infected pool which is there in the country today will not be able to infect any more people. Now, let me convey this very clearly, categorically, that the most important challenge before India today is to prevent any further spread from the presently infected pool to the rest of the country. Now, irrespective of what stage you want to call it, but certainly, as you yourself said, the number of cases being reported is definitely on the rise. So I would say that we are still at the foothills where the numbers are on the rise, but still not very large. So whatever is the infected pool in our country, we must do everything possible to prevent these people from infecting any more people. And for that, lockdown and 100% compliance of the lockdown by entire India is the only effective known method.
Okay, let me take this to Sujatha Rao on how this is being implemented as of now. At this point, we are seeing governments get really strict even threatening penal action if the lockdowns, the curfews are not really adhered to? Is that really the only way? And what about the side effects of this? We saw workers from urban areas trying to flee into the villages. Now that has been stopped as well. What are the things that need to be taken care of at this point?
I couldn't hear your last bit of your question, but
I was talking about workers in the informal sector who are fleeing back home, and now they can't anymore because that was dangerous as well. But now the concern is, what are they going to do for their meals every day? Daily wages are not in place. So how do you grapple with this situation?
Well, there are multiple questions you're asking. But one of them, as you know, I would like to reiterate the earlier speaker in saying prevention continues to be our best strategy, because we cannot afford a full-blown eruption and explosion of this infection in India. The thing is that whether is it gone into the community or not, by just simply locking up is not going to be the solution. That's only one of the 4 steps in a preventive strategy. Lockdown is one of them. Isolation and social distancing is one of them. The other 3 pillars are testing. You have to first know where the virus is. You have to know what the trajectory of this virus is. Where is it circulating? Without that, in the abstract, you just simply cannot lock up the whole population and say, okay, stay at home. If I'm infected and I'm locked up with 10 of my other family members inside a small house, remember many people live in small houses, I could be passing on the infection there. So when your lockdown is over, these people could be already infected. So lockdown in isolation is not the issue. Testing you have to do. Second is information dissemination. When you say urban poor are going back to the rural areas, as of now, I don't think they're infected because they've not come in contact. So I believe, and if it is true that it's not spreading to the community, the likelihood of them being infected is not there. So they're not carrying the infection back home. But having said that, well, you might cordon off all the cities and towns, but the whole country being locked up for a week, it's not possible. It's just not, it's impossible to conceive of it and implement it and enforce it. So I think there are 4 steps of prevention. 1, yes, you do your social distancing, but bring in behavior change of people keeping a distance of 1 meter from each other. Bring in behavior change for washing hands. Bring in behavior change on how you methods of coughing and so on. Test everyone who has the slightest symptoms, but then research seems to suggest, from other experience seems to suggest, that is the asymptomatics who are the drivers of this epidemic. So how do you get hold of those asymptomatic patients? So that's the biggest challenge in testing. Make testing more accessible, have more testing sites, and I believe at this stage of our epidemic, we should make it free, not bring in a 4,500 rupees and 8,000 rupees you go to a private sector. Let us be able to come up with a proper protocol and understanding the private labs and make this free so that we encourage people to come forward and test. That's the only way we can control this epidemic, by knowing where the infection is. Yeah. We don't know.
No, but the fact is, the problem also is, and let me get Dr. Kumar in on this. Now, at least private testing has been allowed. Private testing has been allowed, and it is likely that those who are affluent and, with a doctor's note will use those services. Hopefully that 4,500 rupee fee will help subsidize other services which are required. But to what extent is that going to help? Will that increase the numbers we see? Because statistically, you test more, perhaps you will see more people. And then what happens? Do we still need to continue the lockdown then to stay safe? Dr. Kumar.
I would say, again, reiterate. So even if you test and you find somebody to be positive, so to prevent that person from infecting other people, you still need isolation. So I would reiterate, if I was to prioritize these, preventing the chain of infection for me as a doctor today is the biggest priority. Now, as far as testing is concerned, let me tell you that it's not that on day one. For example, if I am a known patient and I have come in contact with somebody and that person goes and gets the test done tomorrow, and if it's negative, it's not necessary that it's finally negative. It's been shown that if you repeat it a few days later, it may turn out positive. So there are some fallacies with testing. So I have nothing against testing. I totally agree that we need to test, but then testing is not going to prevent the transmission of infection directly. After testing, once you have found out that this person is infected, you still need to isolate him. Plus, there may be a large pool who's not qualifying to be tested but is still infectious. So taking an overall strategy for a country of our size, I would say that preventing the chain of transmission should be the biggest and first priority. 100%. That involves coughing etiquette, that involves social distancing. If you have to go out, you must practice that 1 meter distance. You must practice hand hygiene. We have been stressing repeatedly on the use of soap and water. So all these are part of my infection prevention. So prevent the chain of infection is the biggest priority today. And I think preventing cross infection of the uninfected population from the presently infected population is the biggest priority today. We do not know how many people are infected, but whatever is the number, they are out there in the society. If we can prevent cross-infection of the uninfected people from these infected people by barrier measures, we would have broken the chain of transmission and thereby contained this disease from reaching an menacing proportion.
So, Dr. Kumar, since I have you here, let me ask, some questions that people are really wondering about. So, and these are very basic ones, so please bear with me, but people really want to know.
No.
So, a lot of housing societies, for example, have stopped all, part-time domestic help from entering, or delivery people from entering, or the people who live in their societies from even exiting and entering the gates of the societies for fear that, the transmission will take place. Are these valid concerns?
So, the number of, for example, suppose somebody stays 10 kilometers away and that person has to travel 10 kilometers every day, and you don't know how many people he or she is coming in contact with while traveling, and then that person reaches and comes to your house every day. Now that person definitely has a significant potential of bringing infection to your house. So this is one way that if you do want to have these domestic helps and all, if you keep them at your own place, if you make them a part of your family, so just as your family is there within your house, so if they also are contained within that residential complex and are not having a contact with outside world, then they have lesser chances of acquiring infection and bringing that infection to you. So I would support this measure.
One more FAQ. What about the morning-evening walk? Keeping social distancing.
Morning evening walks is a total no. As I said, we have to lock ourselves inside the house except for the bare minimum family members. Nobody else should be interacting with us. And even while we are locking ourselves inside the house, we have to take a very special care of elderly people. So they should preferably be in a separate room. If anyone in the house has a cough, he must wear a mask all the time. As of today, ICMR has not recommended routine use of mask. Mask is only recommended if you are having a cough. But for elderly people, if they have cough, they also should put on the mask. And we must practice barrier nursing, which means the minimum number of people should be entering their room. Their room should be well ventilated. It has been shown that if you are in a closed air-conditioned room and somebody comes and coughs there, you have higher chance of getting infected compared to if it's an open, well-ventilated, well-lit room. So therefore, that should be done. Every item which is coming to their room should be sanitized. Now, this includes utensils, towel, all other bed sheet and other things, and frequent hand hygiene, which means washing your hands frequently and washing them correctly. Now, correctly is as important as frequently.
Yes.
So anyone who's entering the room of elderly people must wash hands correctly before you enter. So
Okay.
these are precautions. If we take, we will reduce the chances of cross infection.
Mr. Rao, let me get your take in on some of the measures that we're taking, especially with the informal sector, because no other time has the difference between various parts of India been so starkly visible as of now. There is one set of Indians who are grappling with work at home and, internet speeds and boredom and things like that. And then there's another set who suddenly found their daily wages have disappeared. What can be done for them?
Those who are bored can certainly be more creative and find some how to entertain themselves, reading and watching TV or movies or whatever. That's not my concern. That's not my worry. But the people who are losing their daily wages are certainly a cause of concern, because that means they're not getting enough money to buy their basic essentials like food, and they're obviously the bread earners of the family. So it's a it's a big social crisis on our hands if we don't do anything about bringing in welfare policies quickly aboard. We have to have a safety net for them. And I think it's just not enough only to say government. Of course, government has a primary responsibility to address this issue. But I do feel that the whole society must, all of us who are well off and can afford, should also try to put in our 2 bits to try and alleviate their problem. But it is a very serious social crisis if we allow it to go unaddressed.
Absolutely.
And it is not for us to look the other way.
No, absolutely. Let's stop waiting for the government to come in and do everything. If you know of a cluster of people who are stuck like this, without daily wages, come together and help out. Come together and help out. I'm absolutely out of time, but Dr. Kumar, if you have a last word, but very quickly, please. I'm out of time almost.
So these economically deprived people, this is the time when India has to show that we care for them. They look after us. They are a part of our family. And I think it's not just the government. It's the duty of each one of us to see to it that their houses have as much food supply as our houses
Absolutely.
have. This is the time for India to show that it cares for its people.
Absolutely. Thank you so much. Thank you so much, Ms. Rao. Please forgive me. I'm completely out of time, but we will have you back on again. And Dr. Arvind Kumar for speaking with us. I have to take a very short break. When I come back, how can we forget what's happened in the markets today? Trading was halted. Heartbreaking, manic Monday is really not enough to describe it. I'm coming back with the best voices, the biggest voices on the Lal Street to tell you what could happen next. Don't go away.